Show. Now, there's news this morning about Brazilian butt lifts. Before I can tell you about it, I need to understand what they are. They are basically bad for you, according to the British Association of Aesthetic Plastic Surgeons. Let's talk to Fulvio Ursobiada from the Eterno Plastic Surgery in our area. Good morning, Fulvio.
Hello, hi, good morning.
Very good to have you with us. Can I walk down the street in Slough and book myself a Brazilian butt lift?
It would be a bit trickier than that, I would hope. You would have to go to a hospital and see someone qualified to do it. They'd need to see you twice, 2 separate consultations. You'd need a 2-week cooling off period if they're adhering to a voluntary code of practice. And then, yes, you could book in.
Yeah. So what are we talking about here? What is a butt lift?
So a Brazilian, buttock enhancement can be performed by use of implants or by fat grafting, and a BBL usually refers to fat grafting. So fat is liposucked from elsewhere in the body, from an area you don't like. It's normally around the buttock, just to sculpt that area a bit better, so the waist and the flanks and that kind of, and the front of the tummy. And then that fat is processed and it is grafted back in. So it's put back in very carefully so that it should, or the majority of it, should survive.
So we're used to this term liposuction. That's been around a long time as a way of removing fat from the body in a cosmetic surgical procedure. This is taking fat and then putting it back in the body, as you say, to sculpt your buttocks, and basically make them bigger.
Yes.
And what would you say the level of popularity of this is? How many people are coming to see you, going into similar cosmetic surgeries and saying that they're interested in having a bigger bottom?
Well, in absolute terms, it's not the most common procedure we do. There's still liposuction, breast procedures and tummy procedures. But in terms of growth, it's been staggering. So the rate of people coming along looking for Brazilian butt lifts, this was almost an unheard of request 5 or so years ago. And now it's pretty frequent.
Why is it dangerous?
Well, they're dangerous because I think it's partly promoted by sort of celebrities with very, very obvious large buttock enhancements that they've had. Patients coming in and saying, I would like an enlargement, but I don't want a small one. I want a really big enlargement. And the safe response to that is that's not possible in one go. And the reason for that is because if you put too much fat in one go, most of it won't survive. But if you are very, keen to please your patient or perhaps throwing caution to the wind, then you might be tempted to put it in more than the safe plane. So that if you think about it, there are 3 planes of the bottom. There's the muscle, an important muscle, and there's the plane below that and the plane above it. The only safe plane, in my view, and this has been announced by my society, is the plane above the muscle. If you try to go in all 3 planes, that's extremely unsafe. Even if you try to go in the top 2, you may inadvertently get to the 3rd. And in that 3rd one is where these important blood vessels live.
So you wouldn't have thought, though, that you've explained that really clearly. You wouldn't have thought that it was possible, however much you wanted to have a bigger bottom, to walk into any kind of medical facility and ask for something that's known to be unsafe, but clearly it is.
I have to say, this is not something that the very large volume BBLs in responsible organisations and responsible practitioners, and certainly in the UK, I think is less common. One hears about these stories more overseas, where perhaps the regulations are not quite as vigorous.
That was my next question. Do you think there's a big market in that? People go to Turkey to get their teeth done and all that sort of thing. Is there a market in going abroad for this kind of surgery?
I see in my clinics people requesting correction for botched overseas surgery every week, every single week.
Very interesting. And is this something that, presumably it's more women than men, it might be all women who want this?
A BBL, yes. It's almost exclusively women who request that, in my experience.
And are we talking about white women, black women, Asian women, or all women?
All women, yeah, all women. White, black, Asian, every race.
Interesting. Thank you very much indeed for coming on the show. I really appreciate talking to you. Thank you very much.
You're very welcome.
Fulvio Ursobiada from the Eterno Plastic Surgery, which is in Slough. 16 minutes to 8, BBC Radio Berkshire. Have you had this? 0808 100 5100. Put the call in now. Let's check the road, see what's going on as far as your journey's concerned this morning, see how that's all panning out.